there, I'm Ashley, and this is my sister Jess, and we are going to be demonstrating a head-to-toe assessment today. So Jess has something she has to read before we begin.
I, Jess Varney, consent to this video for education and demonstration purposes. I understand that this video will be placed on YouTube to be viewed by BTC nursing faculty, and that this video will be submitted to a student e-portfolio.
Okay, thank you. Okay. Good morning, Jess. How are you today?
I'm doing very well, thank you.
Good. And what brought you into the office today?
An overall checkup, I think.
Good. Good. Do you have anything that you want to talk about before we begin? Any pain or any issues that have been bothering you?
I have a hostile uterus, but other than that, doing pretty good.
Oh, I know. Nice OBGYN for you for that.
Perfect. We'll chat about that after.
Okay. All right. So we're going to begin by I'm going to inspect your scalp first. So I'm going to part your hair in a few different places, just taking a look at your scalp, looking for any dryness, redness, irritation, any sores. Have you had any trouble with your scalp at all?
No, none at all.
Feels good?
Mm-hmm.
Okay. Good. And then I'm going to take a look at your ears. I'm going to palpate your ears. Do you have any pain?
No.
Okay.
No issues there.
Good. And I don't have an otoscope available, so I'm going to just improvise here. So I'm going to pull the ear back and up and look inside. I'm going to visualize the tympanic membrane with a cone of light, and the tympanic membrane should be smooth, no swelling and no redness. And we would look on both sides for that. Okay. And then I'm going to check your hearing. So I'm going to stand about 2 feet away from you. I'm going to have you occlude one ear, and I'm going to whisper a number, and you tell me what number you hear. Okay?
Okay. 33.
Great. And then switch.
22.
Very good. Okay. Next, we're going to do the Weber test. So I'm going to hit this, and I'm going to put this on the top of your head, and you tell me if you hear this equally on both sides or one more than the other.
Oh, it's very equal. Buzz, buzz.
Good. Okay. And now we're going to do the Ryan test, which you let me know when you no longer hear the vibration. And then I'm going to move it.
Mm-hmm.
This is checking conduction.
No more.
Here now.
Yes.
Oh, perfect. And we would repeat that on both sides. Okay, next we would be looking at Jess's eyes, and first I just look. The sclera will look white and healthy. I'll pull down on her eyelids here. The conjunctiva look pink. Lacrimal glands look normal, and the pupils look symmetrical. I'm going to use a pen light. I'm going to shine the light from back here, and I'm looking to make sure that the light is equal in both pupils, which it is. And then I'm going to check constriction, pupillary constriction with the pen light. Good. And then this side. Good. Okay. And Jess, we're going to check your peripheral vision. So when you see my fingers in your periphery, you see them.
Yeah.
That's very good. How about down here?
Yep.
Great. Okay. And then also we would use the Snellen eye chart. We would have that on the wall, and Jess would stand about 20 feet away and read the smallest line that she could to get what vision she has. Okay. Next, we're going to look at your nose. So I'm going to look at the mucosa inside your nose, which looks healthy and normal. Okay. And then we're going to look in your mouth. So open your mouth. I'm going to look at the lining of your mouth and your gums. Can you smile? The gums are nice and pink. And then open again and let me look under your tongue. Perfect. And I might be using a light when I do that, which would be more helpful. Good. And your teeth look normal. Have you had any trouble or any pain or any loose teeth? No.
Mm-hmm.
Okay. And then can you just say so I can visualize your pharynx and the uvula, which is midline. So that's good. Great. Okay. Next, we're going to kind of check some of the cranial nerves. So the first thing I'm going to do, first I'm just going to palpate your face, your forehead. Any pain?
Mm-mm.
Any pain here?
No.
And then can you clench your jaw? Any pain here?
Mm-mm.
Okay. All right, I'm going to use a little piece of cotton, and I'd like you to tell me when, with your eyes shut, when you feel me touch you with the cotton, okay?
Okay. Yep. Mm-hmm. Yes. Yep. Mm-hmm. Mm-hmm.
Okay, and then we're going to do that with something a little sharper, okay?
Okay. Yep. Yep. Mm-hmm. 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 Mm-hmm.
Great. Okay. And then we would check the corneal reflex by using this little cotton ball as well. So we would use just a little piece of the cotton, and this is checking the blinking reflex, corneal reflex. So I'm going to just barely touch Jess's eye, which that was a good reflex. And then we're going to check the gag reflex, but I'll just explain what we would do instead of actually torturing my sister. So you would say ah, I would be using the tongue depressor, and I would just gently touch the back of your throat and elicit
A gag.
hopefully a gag reflex. Now I'm going to have you try to turn your head from side to side with a little resistance. So, yep, on this side, good. And then shrug your shoulders, good. And that's, I'm applying some resistance to her shoulders, checking cranial nerve 11 with that. Now, hypoglossal reflex, we're going to have you stick out your tongue. Good. And then can you push your tongue into either side of your cheek? Great. And then can you raise your eyebrows and squeeze your eyes shut? Good. And smile and frown. Good. Can you puff out your cheeks? Great. Okay. Wonderful. Okay. So cranial nerves seem intact, which is great. Now we're going to move to the neck. I'm going to feel your lymph nodes on the back of your head and then down your neck, okay? So I'm just feeling for the lymph nodes along the back of the head and down the neck. I'm feeling for anything hard or shouldn't be anything. And down by the collarbones is also really important to feel. Good. Okay. And then just tip your chin up a little bit so that I can visualize the trachea, which is midline. Looks midline. And then I'm going to have you swallow, Jess, and I'm going to feel for the thyroid, which feels normal in size. It doesn't feel enlarged at all. Another way to do this is from behind, putting your fingers just below the carotid cartilage. You can displace the trachea to either side and kind of feel the thyroid as well. Okay.
Mm-hmm.
So next, Jess, we're going to listen a look at your back. So I'm going to have you move to the chair here. I'll have you sit here. And Jess would be in a gown. Let me just adjust this a little bit. Jess would be in a gown, so we'd be able to visualize her back and inspect her back, which looks nice and even. Just bend over a tiny bit so I can look at your spine. And there's no curvature of the spine. Let's sit back up. And then I'm going to put my hands on the sides of you, with my thumbs in the middle, and I'm going to have you take a deep breath. And I'm just looking at chest expansion to make sure it's symmetrical. So go ahead and take a deep breath. And so my thumbs slide apart and come back together pretty equally on both sides, which is good. I'm going to palpate your vertebrae, Jess.
Mm-hmm.
Let me know if you have any pain.
No pain yet.
No pain.
No.
Good. Okay. And now I'm going to percuss the back. So we're going to just go right down. Good. Okay. Now I'm going to listen to Jess. All right. So just take some breaths. Good. 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 And then listen over here. And then listen over here. Great. Okay, and then Jess, if you can turn around, we're going to do the anterior part of the thorax. Okay. So I'm going to percuss in a few different spots here. Good. And then I'm going to listen for anterior Jess's lungs. Good. Okay. That all sounds great. Okay, now I think what we'll do now is cardiovascular. So I'll have you lay back down, Jess, on the table here. So first, we would be just inspecting the pericardium. We would look for the point of maximum impulse and palpate that to get a sense of the heartbeat. And then we would be listening to 5 points of the heart with both the bell and the diaphragm of the stethoscope. So we've got the pulmonic valve, and then we've got Erb's point, and then we've got the tricuspid. Then we have mitral valve, and then aortic. Good. And we would listen with both the bell and the diaphragm of the stethoscope. And then I'm going to check Jess's carotid pulses. So I'm going to feel here a nice full bounding pulse, and on this side as well. Same, nice strong full pulse. And then we'll listen for bruits over the carotid with the bell of the stethoscope. Okay. No bruits. Okay, great. And now we're gonna move to the abdomen. So inspection of the abdomen looks normal. And we're going to listen to bowel sounds in all 4 quadrants of Jess's abdomen. Sometimes it can take a little time to listen until you can actually hear bowel sounds in all 4 quadrants, but for purposes of making this video move along, we're going to just demonstrate what the technique is. I do hear bowel sounds, so that's good. Okay. And then while I'm here, I'm also just going to listen to for bruit over the aortic vessel here. It's above the navel. And just while we're thinking of it, I want to palpate the aorta, which is midline and normal in size. Now, next we're going to palpate Jess's stomach. Well, we will percuss first, and then we'll palpate. I'm going to percuss Jess's stomach. then suprapubic and epigastric as well. And then I'm going to percuss for dullness of the liver. So I'm going to low. And in an adult, it should be a 6 to 12 centimeter span that you percuss for the dullness of the liver. And then I'm going to palpate Jess's abdomen lightly at first and then a little bit deeper after that. So just let me know if this hurts or bothers you at all. Any pain?
No.
No?
No.
Okay.
No pain.
And then I'm just going to a little bit deeper.
Mm-hmm.
Any pain? Good job. It tickles. Sorry. Okay. And then I'm going to palpate the edges of the liver as well. So right under the ribs, and I'm going to go up and under and palpate Jess's liver. Good. Okay. All right. Great. Now we're going to have you sit back up and we're going to look at your upper extremities. Okay. So let me just see your hands and we're going to be inspecting your hands. Okay. Your hands and your nails and your skin looks good and normal. And
Why, thank you. I moisturize.
How about your finger joints? Have you any pain?
No.
No. How about here? Any pain in your joints?
Mm-hmm.
Okay. And I'm going to just check your capillary refill on your fingers here. That's good. On this side. Okay. And then we'll check wrist range of motion. Can you flex and extend your wrists? Good. And then can you move them in circles? Good. Great. Okay. And then shoulder, elbows. Can you just bend, flex, and extend your elbows? Perfect. Good. Shoulders. I'm going to have you reach up above your head. Good. And then down. And then reach out to the side. Good. And down. And then bring your arms up like a field goal. And then up. Goal. Down.
Ooh.
And then can you reach across your body? Good. And then this way. Good. Great. And we're going to move to lower extremities now. So I'm going to look at Jess's.
Tilt the screen.
Yeah. Maybe I'll take. So I'm going to look at Jess's feet and ankles. So feet. Any pain in your feet or your ankles? Your Achilles? No, nothing. Okay. How about this side? I'm also looking at any edema that might be in the lower extremities or in the feet. Nothing? No pain?
No.
Okay. So now we're gonna check pulses. I'm gonna check dorsalis pedis, which is at the top of the foot here.
Mm-hmm.
Good. And then posterior tibial, which is on the inside here of the ankle. Good. And I'm gonna do this on this side as well. Good. Great. Okay. Let's check ankle range of motion, Jess. Can you flex your feet? Can you point your toes? Can you turn your ankles in and then abduct them out? Good. And can you roll them? Perfect. Okay, we're going to move to hips and knees now, okay? So I'll have you lay down. All right. So we're gonna I'm gonna have you bend your leg up, Jess, and bring it right into your belly. There. And then can you bring your leg out to the side? Good. And then back in and down. And then can you bring your leg out? So abduct and adduct the hip. Good. And same on this side. We're gonna bend the knee up, checking the knee range of motion and the hip kind of at the same time. Bring down. And then we're gonna then we're going to do out to the side and then back in the line. Good. Perfect. All right. Next, we should check reflexes. So I'll have you sit back up, Jess, okay? And we're going to check your bicep reflex. So I'm going to have you rest your arm on me. I'm going to find the tendon here. And I'm going to check for your bicep reflex. Find the tendon. Good. Okay. And then we're going to check brachioradialis reflex. Good. Okay. And then we'll check your Achilles.
Don't tilt screen.
Oh, yeah. Well, let me do tricep. Let's do tricep. So I'm going to have you go like this. Good. This way. Good. Okay, we'll check patellar. Patellar. Okay. And then we'll do your Achilles reflex. I'm gonna hold your foot. Good. Hold your foot here. Good. All right. And plantar reflex. I'm gonna drag this. Good. Okay. Perfect. All right. Now we're gonna do coordination, checking cervical coordination. So I'm gonna have you strike your thighs and turn them over, and then try to do this fast. Great. And then next we're going to have you take your finger up to the side and point and touch your nose. Good. Can you do it with both sides? Good. And then I want you to touch my finger. Good. Okay. And then I'm going to have you stand. And first, as part of the lower extremity assessment, you would observe their gait. So I would just have Jess walk normally. I'm looking for an even normal gait. And then I would have Jess try to walk in a straight line, so heel to toe. Heel to toe. Good. And then I might have you walk on your toes. Good. And then the Romberg test would have Jess standing with her feet together. And then I would have you close your eyes, and you should be able to maintain your balance for 30 to 60 seconds. And that you can do. So that's great. Have I forgotten anything? That's all I have for now. I mean, we omit the breast and lower half of the female anatomy kind of exam, but hopefully I've remembered to do everything. We checked sensory by sharp and dull with the face. We could do it on the hands as well, I suppose, to check sensory. So we could, if you shut your eyes, let me see your hand. I'm going to, you tell me when you feel me touch your fingers.
Yeah. 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 Mhm. 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 Mhm.
I'm going to do the same thing with a cotton swab. Let me know when you feel.
Yes. Yep. Mhm. 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 Mhm.
Great. Okay. Well, that's all I have. Thank you for watching.
She was a great nurse.
Thank you for participating.